Hi, everyone, and welcome to the deep dive. You know that sound, right? That kind of really weird honking cough dogs sometimes get.
Yeah, it's pretty unmistakable once you hear it, almost like a goose honk sometimes.
Exactly. So today, we're really going to dig into that canine infectious tracheobronchitis, or what most people just call kennel cough.
The common name?
We'll look at, what it actually is, the signs to watch out for, what you need to do if you think your dog might have it, and yeah, how to prevent it.
Right. We've gone through a couple of useful sources. One's sort of a quick overview, good for the main points, and another digs a bit deeper into symptoms, treatments, prevention, that kind of thing.
Perfect. So we're trying to piece it all together for you.
Yeah, I give you that essential info so you feel, prepared and not overwhelmed.
Exactly. So if you're a dog owner, maybe your pup hangs out with other dogs, or you're just generally curious about common dog stuff, this is definitely for you. We'll break down the important bits.
Sounds good. Where should we start?
Okay, let's unpack this. What exactly is kennel cough? Because that name itself, it kind of points you in one direction, doesn't it?
It does, yeah. And while you definitely see it linked to kennels or shelters, it's really a broader thing. It's a highly contagious respiratory illness.
Yeah, okay.
Some vets call it CIRD, canine infectious respiratory disease. And the interesting thing is it's usually not just one single germ.
Oh,
Often it's like a tag team of different viruses and bacteria working together.
huh. Like a respiratory supervillain team up.
Sort of, yeah. And that complexity, that's partly why there isn't just one magic bullet cure and why, prevention often involves tackling multiple potential causes, like through vaccination.
Right, right. That
Yeah.
makes sense. And it sounds like it doesn't really pick favorites. It's not just like puppies or older dogs that get it.
Nope, not at all. Any breed, any age,
Yeah.
from a tiny Chihuahua right up to a big Doberman, they can all potentially catch it.
Oh.
But because it spreads through the air, think coughs and sneezes, like our colds, you do see outbreaks more often, where lots of dogs are packed in together.
So kennels, obviously, but where else?
Yep, kennels, shelters, doggy daycare places,
Yeah.
even things like dog shows. Anywhere there's a concentration of dogs mingling.
Okay, that makes total sense. Prime opportunity for bugs to spread. So, thinking as dog owners, what are the flags we should be watching for? How do we spot this?
Well, the number one sign, the classic one, is that cough we mentioned. It's usually very distinct.
How so?
It's often described as like dry, hacking. Sometimes people really do say it sounds like a goose honking. It's this abrupt, forceful sound.
Okay, dry, hacking, honking. Got it.
And often it comes with gagging. Sometimes the dog gags so hard they might bring up a little bit of like white, frothy stuff.
Oh, poor thing.
That sounds pretty unpleasant.
It is. It's called a sterile cough sometimes, meaning it's mostly irritation causing the gagging, not necessarily deep lung stuff coming out. And I think one of the sources mentioned something about their throat being sensitive, like even touching it.
Yes, exactly. The windpipe, the trachea gets inflamed.
Yeah.
So even just gentle pressure, like from a collar or even just petting their neck, can trigger a bout of coughing.
Ooh. Yeah.
And you might also notice the coughing gets worse with exercise or excitement, or even just when they pull on the leash during a walk.
Right. So key signs, that honking cough, maybe some gagging, sensitive throat area, and it flares up with activity. Seems pretty clear. But I also read something that seemed a bit counterintuitive, that a dog could have it without coughing. How does that work?
That's a really, really important point.
Mm-hmm.
Because while that cough is the headliner, the most common sign, it's not the only sign.
Okay.
Sometimes a dog might just have more subtle things going on, maybe more sneezing than usual, or runny eyes, like a clear or maybe whitish discharge, or a runny nose, again, usually clear or whitish.
So like cold symptoms in a way.
Kind of, yeah. So just because there's no big dramatic cough, it doesn't automatically mean everything's fine, especially if they've been, at daycare or the kennel recently.
Good to keep in mind. Don't just focus on the cough now.
Yeah.
What about the more serious stuff? The things that should make us think, okay, this needs urgent attention.
Right. Because while a lot of kennel cough cases are relatively mild, sort of like a bad cold.
Annoying but manageable.
Exactly. But there are definitely red flags. If your dog develops a fever, that's one. If the cough changes from that dry hacking sound to something wetter, more productive, like they're coughing up mucus.
Okay, yeah, that sounds more serious.
Definitely. Also, a big drop in appetite or refusing food altogether, or if they seem really weak, lethargic, just not themselves. And any kind of difficulty breathing, labored breathing, that's an emergency.
Why? What could those signs point to?
Those could mean it's progressed beyond just irritating the airways and might be turning into pneumonia, which is a much more serious lung infection.
Okay, pneumonia is definitely scary. And didn't one source mention a link to distemper? Is that common?
It's much less common now, thankfully, if dogs are properly vaccinated. But yes, if the underlying cause happens to be the distemper virus, you can see really severe signs on top of the respiratory ones, things like vomiting, diarrhea, even neurological problems like wobbling, circling, or a head tilt.
Wow, that really hammers home the vaccination point, doesn't it?
Absolutely. Core vaccinations are just so critical for preventing things like distemper.
Okay, so let's say we notice some of these signs, maybe the cough, maybe something more worrying. What is the absolute first non-negotiable step?
Call your vet immediately. Don't wait and see.
Just get them checked out.
Yes. You need a proper diagnosis. The vet needs to figure out what's going on, rule out anything more serious, and decide on the best treatment plan. Don't try to guess or self-diagnose.
Makes total sense. Get the professionals involved. So what kind of treatments might they suggest? It sounds like it could vary quite a bit.
It really does vary. It depends on how sick the dog is, their age, overall health, and what the vet thinks is the main culprit, virus, bacteria, or both.
Right.
For, a generally healthy adult dog with just a mild cough, the vet might just say, okay, strict rest, make sure they drink plenty of water, like managing a cold.
When it might just clear up on its own.
Often, yes. It usually takes about, say, 3 weeks for a mild case to resolve, though sometimes that cough can linger for, gosh, up to 6 weeks, which feels like forever.
I bet 3 to 6 weeks of honking. But what if the cough is really bad, like keeping the dog awake?
Yeah, if the coughing itself is really disruptive and preventing rest, the vet might prescribe a cough suppressant.
To calm the cough down.
Exactly. It doesn't cure the infection, but it can make the dog more comfortable, reduce irritation, and help them rest, which is important for recovery.
Okay. What about for more severe signs, like that fever you mentioned?
If there's fever or significant inflammation, they might use non-steroidal anti-inflammatory drugs. NSAIDs, the dog-specific kind, of course.
Right, important distinction.
And if it does progress to pneumonia, well, that often requires hospitalization. It might need IV fluids, stronger medications, maybe even oxygen therapy to help them breathe.
That sounds intensive. And antibiotics, when do they come into play?
Good question. Antibiotics are for bacterial infections. So if the vet suspects a bacteria like Bordetella bronchoseptica, which is a very common player in kennel cough, is involved, or if they're worried about a secondary bacterial infection setting in, then yes, they'll likely prescribe antibiotics.
But not if it's just viral.
Correct. Antibiotics don't work on viruses, so they aren't an automatic thing for every case.
Okay. And this seems like a super important point that came up. Under no circumstances should we be reaching for our own medicine cabinet, right? No human cough syrup or anything.
Absolutely not. Please, nobody do that. Many human meds are dangerous, even toxic for dogs.
Really crucial warning.
Always, always, always stick to what your veterinarian prescribes specifically for your dog at the dose they recommend. Don't guess, don't substitute.
Got it. Vet care first. Prescribed meds only. Okay, so that's the reactive side. Let's shift to being proactive. How do we stop our dogs getting this in the first place? Prevention.
Prevention is key, definitely. And the single most effective thing, vaccination.
The kennel cough vaccine.
Exactly. Well, vaccines, plural, sometimes, they significantly reduce the chances of getting sick, and if a vaccinated dog does catch it, the illness is usually much milder. Plus, it lowers the risk of nasty complications like pneumonia.
Okay. Now, I've heard talk about core vaccines versus non-core vaccines. How does the kennel cough shot fit in?
Great question. So, core vaccines are the ones recommended for pretty much all dogs: distemper, parvovirus, rabies, adenovirus. Essential stuff.
Right.
The kennel cough vaccine, primarily targeting Bordetella, is often considered non-core. But non-core doesn't mean unimportant.
It means it depends on the dog's lifestyle.
Precisely. If your dog regularly interacts with other dogs, think boarding, daycare, dog parks, training classes, shows, then the Bordetella vaccine is highly, highly recommended.
So for social dogs, it's pretty much essential.
I would say so, yes. It significantly reduces their risk in those higher exposure situations.
Yeah.
And the vaccine itself, it comes in different forms, too.
Oh, like what?
There's the traditional injection, but there are also intranasal ones, a spray up the nose.
A nose spray vaccine. Interesting.
Yeah, and the idea behind the nasal one is that it can stimulate immunity right there in the upper airways, where the infection typically starts. Might offer quicker, more localized protection in some cases.
Huh. Worth asking the vet about which type is best then.
Definitely discuss it with your vet based on your dog's specific needs and history.
Okay, so vaccination, especially Bordetella for social pups, is number one. Are there other, maybe smaller things we can do to cut down the risk, even if they're not foolproof?
Sure, there are common sense things, kind of like avoiding colds ourselves. Try not to share water bowls, food bowls, or even toys with dogs you don't know well, especially in public places.
Good hygiene habits, basically.
Exactly. And, pay attention. If you hear about a kennel cough outbreak going around your local dog park or daycare, maybe steer clear for a little while if you can.
Be aware of local
Right.
conditions.
And crucially, if your own dog gets diagnosed, isolate them. Keep them away from other dogs in the house, and obviously no trips to the park or daycare until they're fully recovered and no longer contagious.
Right, stop the spread. Okay, simple but important steps. Now, one of the sources had a handy little FAQ section hitting some common questions. Let's tackle a few. First one, how long does this thing usually last if you don't treat it?
Yeah, people often wonder that. For a typical, uncomplicated case in a healthy dog, it usually runs its course in about 3 weeks.
3 weeks of coughing.
Yeah, but it can sometimes drag on for longer, maybe up to 6 weeks in some cases. It varies.
Okay. And another question was about vomiting. We touched on it, but can kennel cough actually make a dog throw up?
Yes, indirectly. It's not usually the illness itself causing stomach upset, but that intense gagging reflex that often happens with the severe cough.
Ah, the gagging triggers vomiting.
Exactly. They gag so hard it just makes them vomit,
Yeah.
often that frothy, clear, or white stuff.
Got it. And can dogs just tough it out? Can they get over it completely without any medicine?
Often, yes.
Right.
Especially if it's a mild case and the dog is otherwise healthy and has a good immune system, just rest and fluids might be enough.
So medication isn't always needed.
Not always, but, and this is important, if bacteria are involved or if there's a risk of secondary infection, things like worsening lethargy, maybe greenish nasal discharge, not eating well,
Yeah.
then antibiotics might well be necessary.
So again, vet check is key to make that call.
Absolutely. Always best to get their assessment.
Okay, and last FAQ point.
Yeah.
If our dog does have kennel cough, what's the best way to care for them at home? Assuming we've seen the vet, of course.
Right. So number one is rest. Create a calm, quiet space for them. Limit excitement and strenuous activity.
Let their body heal.
Yep. Number two, hydration. Make sure fresh water is always available. Encourage drinking. Maybe even moisten their food if needed.
Good tip.
And number three, isolation, like we mentioned. Follow your vet's advice strictly on keeping them separate from other dogs. And that includes avoiding public places, not just while they have symptoms.
Oh, how long after?
Usually for about 2 to 3 weeks after the symptoms completely disappear. They can still shed the virus or bacteria for a while, even when they seem better.
Wow, okay, that's longer than I might have guessed. Really important for preventing spread.
It really is crucial for protecting other dogs in the community.
Okay, fantastic information. So just to wrap things up, let's distill this down. What are the absolute must-remember takeaways for everyone listening?
I'd say, 1, kennel cough is common. It's contagious and it affects the airways.
Yeah.
2, know the signs, especially that weird honking cough, but also sneezing or runny nose. Don't ignore them.
Got it.
3, vet care is essential. Get a diagnosis, get the right advice. Don't wait.
Non-negotiable.
And 4, prevention is powerful. Vaccination, especially Bordetella for social dogs, is your best bet to reduce risk and severity.
Perfect summary. Okay, and as always, we like to leave you with something to think about. A little provocative thought.
Good.
Given that kennel cough isn't just one mug, it's often a mix, and dogs can actually be contagious before they even show symptoms. What everyday places or interactions, things we don't normally worry about, might actually pose a bigger risk than we realize?
Like maybe just sniffing the same spot on a walk minutes apart.
Hmm.
Or a quick nose-touch greeting.
Exactly. Or even, I don't know, the vet's waiting room or the pet store aisle. Makes you think a bit more carefully about those casual encounters, doesn't it?
It really does. Something to definitely mull over.
Definitely. All right. Thanks, everyone, for taking this deep dive with us today.